Welcome. My name is Leslie Miller, and I've been practicing mind-body medicine for 35 years with a focus on optimal health. I want to offer you an overview of energy medicine and then answer a few questions you might have to understand how I can be of help. Now, I'm going to be using notes to keep me organized, so bear with me. First of all, according to the National Center for Complementary and Integrative Health, which is the government's lead agency for research on non-conventional medicine, energy medicine, or as they have labeled it, biofield therapies, is the act of channeling and manipulating the energy that courses through our bodies in order to heal it. Energy practitioners, we believe that your body is instilled with a subtle energy, the flow of which must be balanced for good health. According to Johns Hopkins Medicine, in traditional Chinese medicine, this force is called qi. You've probably heard of that. And the basis of energy medicine is removing the blocks in your energetic field that can cause poor health. When energies become blocked, that is what happens when you experience toxins, prolonged stress, trauma, muscular constrictions, abuse, difficult challenges in your life. That can create disturbances in the energy flow in our bodies, which over time contribute to mental, emotional issues, physical ailments, disease. And by accessing the information, you can learn what is needed for optimal health. So one of the questions I get is, what type of healing issues do you see in your practice? Well, people seek out my help for sleep concerns, anxiety, pain, headaches, stress, blood pressure issues, relationships issues such as lack of trust, fear of abandonment, unclear boundaries, fear of confinement, fear of commitment, low self-esteem. Next question, what does an energy therapist do? Well, I've learned our body is a living history that keeps a record of every physical and emotional experience, and I help release the energy from, as I said before, suffering, trauma, something that's resulted from a frozen or a trapped emotion. And all my energy therapy techniques are focused at harmonizing the energy fields in and around the body to promote health and well-being. The goal is to productively impact your subtle energy and biofield to help balance, restore, and renew those energies, utilizing techniques that allow you to painlessly and easily release that something that is blocking you from your best life. Now, Dr. Yufeng Lin is an integrative medicine physician at the Cleveland Clinic who works with energy medicine and explains to her patients that energy is the foundation for everything we do with our bodies. The idea is that we have this bank of energy and we have to restore it or replace it. Other people ask me, can anyone benefit from this form of treatment? And I found there's often a misconception that you need to be spiritual or you need to be open and receptive to energy healing. I have found energy healing is readily available to everyone who's interested and willing to receive it. In fact, some of the country's best hospitals are hiring energy medicine therapists. To give you a few, the Memorial Sloan Kettering Cancer Center, Duke University, the Mayo Clinic's campus in Rochester, Minnesota, University of California, San Francisco. Those are some pretty big hospitals that are utilizing energy medicine. I found that there's a misconception of energy healing, that it's going to fix all of your problems in life and you don't have to take any action. Well, I have found once you experience energy healing, it can change your beliefs about energy healing, but it also, when you're ready to dive in and experience energy healing, it's like a domino effect. It will change your belief, which impacts your subtle energy and biofields, which shifts energy and opens challenge for change, whether emotional or physical. Many of my clients begin to feel lighter, more confident, pain relief, increased energy to accomplish something. I recently had a client who just couldn't put her finger on what was holding her back from changing jobs. I told her we can put an energy finger on that and rely on our own feedback systems to determine the source. Release it, check to see it's been released, all without any discussion about the issue. Another example, a man came in to see me with a fear of elevators, had a 20-year fear of elevators. It was a challenge for him because he traveled for business. Again, the subconscious mind provided the core area of the block. With a few sessions, I was able to relieve him of this fear, and he couldn't believe the results. Another, a woman had binging with food issues, and she'd been in therapy for years. And this took some time, but I was able to work with her subconscious mind, identify the source of the original conflict, and allow the subconscious to bring healing and a stop to that non-productive behavior for her. People ask, what should I expect from a session? Well, the recent pandemic, it shifted the way the world seeks help. Telehealth is now common. I chose to move my practice to a virtual space and discovered that very little changed. Thanks to FaceTime and Zoom, we still sit face-to-face with each other because energy is not limited by time or distance. The work is just as powerful in person or over FaceTime. And how do we begin? We begin with a short intake to learn of your concerns and then have an agreement that I can work with your energy fields and centers. I search and scan the body for energy blocks, direct that energy away from the block space, and impact the energy to find balance and flow. During an energy healing treatment, you will feel no discomfort. I non-invasively and intuitively assess your aura, your energy fields, and release energy blockage from the body. As those blockages are being released and energy centers, called chakras, are being balanced, patients often experience a rebalancing process that might evoke a variety of emotions or physical sensations like tiredness, sadness, anger, lightness, warmth, calm sensations over the next few days. That will all balance itself out. When you allow your subconscious to direct these release processes during a treatment, it gives way to space for new light supportive energy flow. When energy centers are stimulated, they can improve energy circulation and rejuvenate corresponding areas elsewhere in the body. I will begin a specific protocol based on the initial assessment to balance, restore, and renew energy points. This can be working with quieting down or a strengthening of specific meridian pathways, balance chakras, identify meridian points that are sluggish, working to alleviate a specific pattern, whether it's emotional pain, physical pain. Please remember that more than one session is probably going to be needed. Now, I talk about muscle testing. So people ask, well, how can you muscle test me if I'm not in the same room? Well, first of all, muscle testing is also known as kinesiology, and it is a way to access the wisdom of the subconscious mind through this framework to identify and confirm information needed to release stuck or trapped energy. Muscle testing is essentially one way to ask the subconscious questions and receive answers about what your mind or body needs in a form of yes or no, with the strength. Strength of muscle, yes. Weakness, the muscle weakens, and some no. So a little history. In the 1960s, a chiropractor named George Goodhart found that muscle testing, that's applying the pressure to the muscles, and this resistance force could be used to learn about how the body and the mind and energy chakras are linked. Goodhart found that simply running his hands over energy pathways often strengthen weakened muscles. I have personally used muscle testing in my practice for years. Now, working in this virtual world, I can muscle test you by proxy. You give me permission, and I act as a proxy. And I use this technique, it's called a link method of testing myself, to temporarily become you. So this, yes, link circle testing, that's a no, and this is a yes, so I can learn more about your wellness needs. Remember, there's no one size fits all when it comes to healing. Energy medicine doesn't replace Western medicine and vice versa, but together various forms of healing modalities and therapies can work in conjunction to effectively support, balance, restore, cure, and repair your body. Seeing productive shifts in my clients is amazing and rewarding. I feel honored to begin to bring this healing modality to you. Please call, text, or email and schedule. Now, during the pandemic, I began offering a complimentary 30-minute session to allow you to experience remote energy work, address questions, or be there for you as you explore this healing journey. So feel free to reach out to me soon. I look forward to meeting you.